Hey, Dr. Libby here. I wanted to talk to you today about estrogen. And is estrogen good for you? Is estrogen bad for you? If you're feeling confused about hormones and are they good for you or bad for you, you're not alone. I think everyone's confused about this, including doctors, right? There's so much information out there that's contradictory, and it's really hard to figure it all out. And I've been trying to figure this question out pretty much my entire medical career. What I realized is what I was taught to do with women's hormones in medical school was not sufficient. And so I started seeking out additional training on this topic 15 years ago at least, because I had women coming to me as a family doctor and asking for help. And I wanted to provide them with help in a safe way possible. And so here's what I have concluded from all of this research. Okay. So we always thought estrogen was relatively good for you. They started talking about estrogen and using estrogen to help women ease through the menopausal transition back in the 1800s. So in 1889, they talked about estrogen in the Merck manual and how it helped to relieve menopausal symptoms. And we were pretty comfortable using estrogen for that reason all the way up until about 2002. I started my medical training in the late 90s. And so, in the beginning, yes, put women on estrogen when they're going through menopause. It makes them feel better. It helps their hot flashes and no worries. And so, this was very common and we prescribed it all the time. Then, 2002, a big study came out that changed everything. It was called the WHI, or the World Health Initiative. And the study was actually stopped early because they started to see some dangers with hormones. And so it was big news. It was headlines everywhere. I remember I was working at the family practice clinic at my residency program. Phones were ringing off the hook. Patients were panicking. Doctors were panicking. We were abruptly stopping everyone on their hormones. We were not starting anyone new on hormones, and women were miserable. And we were all very, very scared. Now, when you look at the data from the World Health Initiative, here is what we found. First of all, these were women that were a little bit older than women when they're actually going through menopause. The average age of women in the study was 63 years old. Most women are going through menopause around 50. And they were on synthetic hormones. Okay, so they were on like Prem Pro, which is a combination of Premarin and Provera, synthetic estrogens. Now, here's the thing about synthetic estrogens. You can't patent things that are natural. So when drug companies go to put out new medications, they want to make it very similar to what your body would naturally make, but slightly different so that they can patent it and make a lot more money off of it. And sometimes things that are very similar to what your body naturally makes are okay. And sometimes they're not okay because it's a little bit different and your body may respond to that differently. So that's kind of the first problem. They used synthetic hormones. They also used oral hormones, which I believe oral hormones are great for progesterone replacement, but oral hormones are not ideal for estrogen replacement. It's much safer to replace your estrogen transdermally, topically through the skin. So, with that being said, the reason the study was stopped early was that they found for every 10,000 women on the synthetic hormones, they had 7 more heart attacks. So that means 9,993 didn't have heart attacks, but 7 women did, more than on the non-hormone group. There were 18 more blood clots. There were 8 more strokes, which kind of goes along with blood clots. Stroke is usually a blood clot of the brain. And there were 8 more cases of breast cancer. Now, they also found 6 fewer cases of colon cancer and 6 fewer hip fractures. But because of these increased risks in the heart attack, stroke, and blood clots and breast cancer, they stopped the study early and we stopped everybody's hormones. Now, remember, even though these numbers are kind of scary, because they do kind of scare me too. I mean, you don't want to be the 1 or 2 people that the bad things happen to, right? But 97.5% of women had no adverse effects at all. But because of this, we just changed the way we prescribed hormones. The only thing we had to offer women at this time to go through the change were things like Prozac and Effexor, antidepressants. It's like, this isn't going to really help the symptoms, but I'm going to make you maybe feel a little happier so that you don't care so much about the symptoms. And so this was the next phase of what we offered women, which definitely was not enough. So that was 2002. But as early as 1 year later, addendum started coming out to this study that started to lessen the risks. So they looked at the data, they started to realize, oh, maybe the risks aren't quite as bad as we thought. And a few years later, in 2006, that same study with the same data came back and looked at it and said, oh, wait, there is no increased risk of breast cancer. So now this is like 10th page news, right? The original study comes out, it's first page news, it's all over the media, it's all over the news. And then all of a sudden, when we're finding, oh, it's maybe safer than we think, this is not getting as much press. And this is just the way news works, right? The more scary and controversial it is, the more attention it gets. And so this is just the way it works. Now, there's a couple of other studies to consider when you're looking at hormones. So there's the World Health Initiative, which showed some risk in some areas, but maybe overstated. And even overstated risks weren't all that bad. But the Ester study, this came out in 2007, showed that it's oral estrogen, not transdermal estrogen that's associated with blood clots. So you switch it from oral to transdermal, risk goes down from what we found in the World Health Initiative. Then there was another study called the EPIC study, and this looked at 55,000 women, and it showed that the association with breast cancer was based on the type of progestin used. Now, there's progesterone and there's progestin. Progestin is the synthetic hormone that the drug companies created that's not natural. Progesterone is what your body actually makes. And so there is, in this study, they showed no increased risk of breast cancer when estrogens are used alone or when they're combined with progesterone and not progestin. Okay. So the other studies kind of helped to clear this up. Are there risks with hormones? Yes, but are those risks negated if you're using topical estrogen, natural estrogen, and instead of a synthetic progestin, you're using natural progesterone? And with those two nuances, the safety profile is very, very good. And so, yes, estrogen's good for you. Then no, oops, estrogen's bad for you, right? And then, oh, when we look at it further, estrogen is actually good for you. And what we do know is that women who replace their estrogen, their overall mortality is decreased. So as I am nearing menopause, I'm not quite there yet, but I'm getting there. I will replace my hormones, and I will do it for the rest of my life because it's part of the picture of optimal health. There's 10 reasons that I am going to take estrogen, and here they are. One is it's good for my heart, less heart disease in women with estrogen, either naturally before they hit menopause or after menopause if they replace it. Estrogen is good for the brain, less Alzheimer's disease in women who have estrogen. Estrogen, if replaced correctly, topically, is anti-inflammatory, and many diseases in our modern day world are driven by inflammation. So that anti-inflammatory effect is huge. Estrogen improves energy production and metabolism. You know how women get that fat in the midsection around as they get older? Yes, that has to do with many things, but lack of estrogen being one. All-cause mortality, death from any cause, is significantly reduced in hormone users versus non-users. Estrogen helps to keep the bones strong and decrease fracture risk better than anything else. It makes you look and feel younger by enhancing collagen production and decreasing wrinkles. That's a nice one, isn't it? It decreases the risk of colon cancer. They even agreed upon that in the World Health Initiative, that scary trial that kind of changed everything, right? It improves blood pressure, it lowers bad cholesterol, it improves good cholesterol, and it relieves hot flashes, night sweats, and helps to improve sleep. Okay. So you minimize your risk with estrogen therapy by starting it right at menopause. The sooner you start, the lesser the risks are. So right when you're going through the changes, a great time to start it. That you use topical, not oral estrogen to decrease your clotting risk. And if you still have a uterus, you need to have progesterone to balance the estrogen, and you want progesterone, not progestin, okay? Synthetic versus natural. And then you want to monitor your hormones with salivary testing. That's the best way to see what's in your tissues. And the goal is to be in the normal range, right? If you're in menopause, you're going to be in the low range. You don't want to be super therapeutic. We don't know what will happen over there. But if this is the range, you want to be right in that mid range of normal. And that's where you feel great. And that's where it's really good for your health too. So I hope this clears up the very confusing picture of estrogen. Is it good for you? Is it bad for you? Yes, the story has changed a lot over the years, but done correctly, estrogen is good for your health. Have a great day.